Hey yo! So today we are going to touch bases on recent updates and research. The first thing we're going to look into is Google search, and I'll read a little bit from them on what is DID and isn't DID. And then we're going to get into the APA with their recent research. What is basic symptoms of DID? And it says here cutting edge update about assessing dissociative clients, etc. Then we're going to get into from didresearch.org on malingering and factitious DID. And then third is from the European Journal of Trauma and Disassociation. Why am I touching subject on this? Well, I feel that updated research is a must, especially with the amount of people giving misinformation, whether they have the disorder or not. I feel it is something that needs to be touched on and looked into because it's not good in the media right now. And I feel that understanding dissociative identity disorder more from the research itself is vitally important. So here's the first piece that I saw on Google. It says DID is associated with long-term exposure to trauma, often chronic traumatic experiences during early childhood. It is often misunderstood and portrayed incorrectly in popular media. Now, next is these three articles here. It states doctors can usually tell the difference between dissociative identity disorder, DID, and malingering, which is faking symptoms for personal gain. However, DID is a controversial diagnosis, and some people claim to have DID for social media attention. How doctors differentiate DID from malingering. 1. Doctors consider a patient's history over a long period of time. So, an example would be my background check. When SSDI decided that they were going to put me on disability and there were signs of already complex post-traumatic stress disorder and many other symptoms, they did a history check. It took quite a few years to get through the history check, school records, medical information, all that. That is something that is looked into when a patient has such a severe disorder. Number 2, they look for inconsistencies in symptom reporting. So they go through, again, your history to see if there is points in time where another doctor diagnosed you with something else, what's been pointed out, etc. 3, they look for stereotypical alternate identities. Next, you will see exaggerated behaviors, dramatic shifts in personality, mannerisms, or appearance that seem overly theoretical or not aligned with the individual's typical presentation. So, basically acting, they can tell. Motivation for attention, if the individual appears to be seeking excessive validation or sympathy related to their cultures. So, in other words, littles are a prime example. More and more people are showing little age regress states online because it gives them more attention. People feel sorry for them and they go, oh, cute. When in reality, it is harming a small age regress state because they are caught in a world that is not theirs. It is a past pretense and it's difficult. So people that really do have DID and have littles, they are usually traumatized, scared. They don't cope well with the world today. They're not cute. They are an alternative state of the mind, usually located in the frontal cortex. And it is something that is difficult to deal with. Littles can raise blood pressure, they can raise body temperature, they can cause immense pain in private areas. These are things that I deal with and other people deal with. So I hope that makes sense. Next is lack of detailed trauma history, a lack of consistent, creditable details surrounding the traumatic experiences supposedly leading to the development of DID. So basically, most people that have been through pretty severe trauma have a trauma trail. Court cases, even evidence of some sort, imagery, medical history, things like that. Some don't. But it's pretty hard to hide something, especially if you're in and out of hospital for injuries. An example would be my finger being cut off. I've had my tooth knocked out. I've had multiple scars located on my body, reconstructive surgeries, etc. So I hope that makes sense. And last is misrepresentation in media. Popular media often portrays DID with exaggerated, dramatic shifts between alters, leading to misconceptions about how it manifests in real life. And what they're talking about is when a person does disassociate and switches, as they call it. Some people, it can be pretty quick. Some people, it can be very slow. For me and some others that I know, it can be very painful. Some people fight it more than others because they don't want that to happen. I'm a prime example of that. I do not want that to happen. I try to hide it as best as I can, and some people judge me for that. But it is, again, as Bethany Brand, who's also going to be brought into this conversation, talks about, it's a shameful disorder. It's embarrassing. It's not something that we choose to do or to show off. It's something that is difficult. Now, challenges in diagnosis. Identifying genuine DID can be challenging due to its complex nature, and a thorough clinical evaluation is crucial to distinguish it from other conditions or malingering. So what they're talking about here, and I've talked about it in prior videos, is basically making sure that they check for other problems. Mildew in your home could be an example of disassociation. It can make you very ill. Blood, you get your blood checked, sugar levels, all that, you name it, you're checked for it. There's a prime example would be the movie Brain on Fire, where this woman literally went through thousands and thousands of tests, and then in the end they thought it was DID, and then they find out it's just a virus. Prime example of what can be mistaken for DID. So basically that's my Google search and a little bit of information on my end. So next you will see this little article here. Individuals with imitative DID truly believe that they have DID and may have had this false belief reinforced by therapists or other concerned individuals. They may generally suffer from dissociative symptoms, though their overall profiles fail to match those of actual DID individuals, particularly in regards to more subtle symptoms. As with deliberate foreigners, those with imitative DID often show less shame or conflict regarding their supposed DID diagnosis. And you can see that Bethany Brand, McNary, Lowenstein, Close-Bar are all on there. Diagnostic instruments such as the SCID/D and MID are capable of distinguishing between genuine and imitative DID when correctly used. Now, I think I do believe I get the SCID, and I may be pronouncing that wrong, every 3 months. I am tested again and again. And my numbers do vary, depending on if an alternative state of mind is out or I am out. These tests are vital to make sure that you are diagnosed correctly. And there are other tests that Bethany Brand is working on with the APA to get correct diagnoses done. Now, next, this one's a little longer. There are potential red flags that can be noticed across a variety of settings that can indicate that an individual may be faking DID. These red flags regard openness about the disorder and one's traumatic history, continuity of memory, affective tolerance, reported abuse that is inconsistent with one's medical history, a lack of comorbid post-traumatic stress disorder, PTSD, trying to prove that one has the desired diagnosis, and dramatic, stereotypical, or bizarre symptoms. Howell, 2011. General indicators of factitious disorder and malingering also serve as indications that an individual may be feigning DID. This included exaggeration, persisting lying, postalegia fantastica. That's a tough one. Sorry. Selective amnesia, lack of consistent work history, refusal of collateral interviews, legal problems, and excessively dramatic behaviors, as well as lack of prior disassociation, and the individual seeking hospitalization or DID diagnoses. Finally, potential indications that one may be feigning DID include a need to assume a sick role, medical legal motivation to label as having DID, demanding or depreciating attitudes towards caregivers, a lack of previous psychiatric history, inconsistencies. Within symptoms, numerous hospitalizations, lack of observed symptoms, or worsening of symptoms while under observation or refusing psychological testing. Generally, individuals with DID usually feel ashamed of their diagnosis and generally suffer from their symptoms features that are often absent in stimulators. I'm sorry, I do have a bit of a speech issue I've always dealt with, and today it seems to be giving me problems. But as you can see, there are a lot of things that they have to rule out when it comes to diagnoses. And I didn't want the diagnosis. I didn't know I had the diagnosis, and most of the people that I know didn't know either. So there are things that people are making difficult for others by saying, I need a diagnosis for this disorder because I know I have it. It's not your job to figure out if you have it or not. It is the doctor's job to give you a correct diagnosis and treatment. And if they're the ones that make a mistake, then maybe you should find a new doctor. That is how I push that. You know, I'm a bit upfront and I'm a bit forward, but I've been through a lot in the last 20 years. So I've done a lot of work to be accurate on what I'm stating and the research that I do. So first off, recognizing signs and symptoms of dissociative identity disorder. Most people with DID rarely show noticeable signs of the condition. Friends and family of people with DID may not even notice the switching, the sudden shifting in behavior and effect that can occur in the condition. The subtle symptoms are often a mixture of dissociative symptoms, such as a sense of being detached from one's self or from one's surroundings, and post-traumatic stress disorder symptoms such as flashbacks. Okay? Someone with DID becomes skilled at displacing and personifying aspects of their experience into other aspects of their self. The shifting happens throughout their life, even once the traumatic situation has passed. This can occur even in circumstances when a trigger for disassociating isn't as harmful as it seems. So, people often experience anxiety, depression, self-puzzlement, disordered eating, self-destructive behavior, substance misuse, memory gaps, and self-harm with the S word. Someone with DID may feel very detached from experiences or even forget doing or saying something that others witnessed. The gaps in memory, confusion, and stress of living with the subjective sense of having not me experiences can become distressing. Those with DID often experience depression, mood swings, and difficulty fully trusting in relationships. Although people with DID have a strong internal sense of identity fragmentation, it is a common misconception that people living with DID display multiple personalities. In fact, in most individuals, the condition is well hidden. So I hope that makes sense to you. So my personal experience. Living with DID has brought me huge amounts of ailments that others have talked about. One is chronic pain, chronic illnesses, autoimmune disorders, fibromyalgia, PCOS, insomnia, anxiety, etc. Another article here explains highly dissociative patients often present with an overwhelming array of severe clinical problems. Few clinicians have received systematic training in assessing and treating disassociation, despite prevalence rates of 4% of the U.S. population. Disassociation is often overlooked or misdiagnosed, contributing to prolonged suffering and poor response to treatment. Dr. Bethany Brand, PhD, provides an overview of controversy about dissociative disorders and dispels myths about dissociative identity disorder. She reviews evidence-based methods for assessing trauma-related disassociation, including self-reported experiences, behavioral observations, screening questionnaires, and semi-structured interviews. The rise of social media portrayals of DID have increased clinicians' uncertainty about differentiating trauma-based DID from self-diagnosing DID in individuals who do not have the full range of classic DID symptoms. Dr. Bethany Brand reviews cutting-edge methods for distinguishing trauma-related dissociation from psychotic and characterological presentations, as well as malingering and factitious dissociative disorders. Finally, using case materials, Brand outlines treatment and forensic implications for dissociative individuals. She has 4 categories here of learning objectives: identify the prevalence of pathological dissociation in the general population, describe 3 types of dissociative symptoms, identify 3 valid measures to aid in assessment of dissociation, discuss how to differentiate foreign from genuine trauma-related dissociation. Great article. So next I'm going to read another article from the European Journal of Trauma and Dissociation where it talks about some testing and recent research. Here it states the procedure. Participants were recruited via various websites including Facebook, Reddit, and online lists geared towards groups of individuals with dissociative symptoms, a DD or professional who treat dissociation. Recruitment materials include a link to an anonymous online survey for individuals with DID. Participants were required to be at least 18 years of age, able to read and understand English, and have a diagnosis of DID. So what they're going to do is a survey. Okay. DID is a traumatic-based psychiatric condition that is poorly portrayed in media and often poorly understood by mental health professionals due to the lack of evidence-informed training about dissociation. The present study found that inaccurate, stigmatizing depictions of DID in media perpetuate misconceptions about DID and contribute to delays in seeking treatment, getting accurately diagnosed, mistreatment, and increased shame and self-loathing among individuals with DID. So, the results. Now keep in mind, Bethany Brand is part of this study. Now, it states here, basically, of the 377 individuals living with DID who completed the online survey about the impact of media portrayals of DID, 309 individuals responded to the question. If you have participated in mental health treatment, do you feel that these portrayals of DID have impacted your treatment? While 153 reported no impact, 151 reported an impact in their treatment. The remaining 5 participants responded that they had not participated in mental health treatment, basically saying they ain't seeking help. Okay, so next was the funding. This work was generally supported by donations received by Towson University Foundation for the support of Bethany Brand's research on dissociation. There's data available for that. And last but not least is this here, and this is the references if you need them. So next here is the 3 phases for receiving treatment for DID. Phase 1, Phase 2, and Phase 3. I'm not going to read them. You can look them up. And last is down below is basically treatment. And this treatment consists of EMDR, CBT, DBT, and DNMS. And it explains in great detail of what is done and what it's about. So that's everything I have today, guys. You're more than welcome to share this with your mental health care professional. And I hope you're doing good, and I'm working on some painting, and I'll be sharing that with you very soon as well. I'm working for my American Legion again, making a charity item to give for donation. So that's all I have today. Loves. Bye.